Hey everybody, good morning. This is Brent Macy, Managing Director of the Institute for HealthCare Consumerism, and welcome to HealthCare Consumerism Radio. Hope everybody had a good week, and actually joining me today in studio, we got Doug Field is actually at AHIP, the CEO and founder of the Institute, so I have Cambria Smith, who is the President of Transitions RBG, joining me in studio. Good morning, Cambria.
Good morning.
Now you're on the way to Florida after this, right?
I am. We're going to have some R&R this weekend, so it's well earned.
Go watch the, you said the country music festival down there?
Yes, down at Jacksonville Stadium, so we're looking forward to a good time.
Yeah, well, we really love having you here. And, to everyone, our audience out there, Cambria actually is, like I said, the president of Transitions RBG that focuses on retiree health benefits. And we'll get into that over the next couple segments and kind of where retiree health benefits are currently. Cambria and I were really talking in the green room about, the exchange space out there, what that looks like. As everybody knows, we've talked about that a lot in the past, private exchanges out there, and then retiree health benefits, big part of the market and what employers are really looking for these days. So I think, we'll touch a little bit on that in the next couple segments, but here on the news and views section, I printed out a couple things yesterday, and very much a trend that's been happening over the past couple years is the high deductible plans out there have continued to grow, and a lot of the plans that are the PPOs or the HMOs are continuing to stay flat, but the high deductible type plans are really moving forward in this market. I think, something that came out the other day was that high deductible plans double for nonprofits out there, and I think you can see that in a lot of companies who are nonprofits. And I think, Cambria, if you look at high deductibles, that is the growth, right?
We see the exact same studies on our end as well with the high deductible health plans. One of the things that employers just need to be aware of, if they're moving to these high deductible health plans and they have an aging workforce, that over 65 market, they need to be aware of when to turn on their Part A of Medicare, their Part B of Medicare, and to confirm that their drug coverage is credible. As we partner with employers, all over the country to help their employees with coordinating those benefits. And so we want to make sure that nobody falls into any penalties or doesn't get the coverage that they need, because the high deductible health plans do affect the Part A and their ability to contribute to health savings accounts.
So if I'm an employer out there and or a broker, I have to guard for my retiree population just against mainly penalties is the number one thing.
Your retirees and your active employees. We have several clients that are up in the northwestern quadrant of the United States, and they've gone to high deductible health plans, and their health plans are not with credible coverage, which is what CMS stipulates has to be equal to or better than what Medicare requires. And so their employees, even as active employees, have their Part A insurance go active, as well as have to enroll in a drug plan, just so that they can avoid those Part D penalties later. Oh,
okay. So there is, a plan design that they really have to pay attention to for both sides of their business, active and retired.
Right.
Interesting. So one of the things, that we've seen on the program, and obviously the high deductible plans are continuing to grow, and I think with the emergence of private exchanges, from everything we're hearing here at the Institute, is that, that's going to increase even more the growth of high deductible health plans out there as well. And one of the studies that came out yesterday was actually something that was done, looks by Accenture. And what they really talked about was that there was an increased growth of number of people who enrolled in the exchanges, and it says 3 million U.S. employees enrolled in private health exchanges, according to this study. And I think it was a little bit of a surprise to some of us in the industry. We've known that it's, these exchanges, when they did come onto the scene, it was going to be an interesting model, and it appears as though from this study that they are starting to gain some steam, across the marketplace. So you've got the front end exchanges, and as Cambria and I were talking in the green room, was you got a lot of the first players that moved were the big consulting houses, whether to go and buy and extend health that had the Medicare retiree health option from an exchange, but you had some other groups that had the normal or the exchange that was for the active employees that's starting to grow as well. From a retiree health side of this, Cambria, where do you see, that exchange, where's the growth there? Do you know?
Well, there's been a big push in the employer side for the last few years to take their retirees and disband those groups and move them to a Medicare type of an exchange, meaning that they're going to go through the exact same process as the private group to go in and search for a plan that's going to meet their needs. And so we've been doing that in the post-65 arena long before the pre-65 exchanges have come around. And so I think it all rolls back to what the relationship is between the organization and their employees, whether or not they have that paternal relationship to where they want to continue to take care of them, or if they're looking at it more from a financial standpoint to where they can still keep promises but move that shift over to that exchange area. So
one of the questions, and from a retiree exchange standpoint, is it still, to the employer out there, what you see with the current employees is that these exchanges are building all these moving pieces to help people become better consumers of health and healthcare inside of the active employee standpoint. Is that the same for the retirees, or are employers building these, retiree health options or exchanges to empower that employee consumer who's using them?
Our organization works in an education and advocacy firm, so we make sure that our retirees that we work with get that. I can't say that all of the employer groups are looking for the same thing, as theirs is more of a sustainability for a retiree group or a trust to make sure that those numbers can continue to be met. And so I think a lot of those are driven through financial, as most of the post-65 groups are Medicare primary and employer plan secondary.
So when you look at retiree health, as we continue to kind of shine the light on that, is you hear a lot of these, companies out there or public entities really looking hard at retiree health, whether it's the post office out there, whether it's, some of the, the cities out there for as an option to some of the other plans that bubble might be getting ready to burst, right?
That's right. We're working with municipalities and organizations and associations and even unions all the way through, trying to figure out what's going to be the best method for sustainability for their retiree population. And a lot of them will shift over to an exchange. Some of them will take alternative measures. But there is a growing trend in that we're looking at the exchange option funded with typically some sort of a reimbursement account, and those can be set up different ways as
from the defined contribution, whether that's an HSA, HRA, whatever the funding mechanism is. I think going back to this, study that was done by Accenture, a lot of interesting information in here. I think, one of the big things that pops out to me is I've heard a lot of different numbers on how many people will be buying their benefits through an exchange from an employee standpoint over the years. It's, 10 million I've heard 20 million, I've heard, 1 million.
Right.
What this Accenture study is saying, it's saying by 2018, 40 million people will buy their benefits through a private exchange. And, I have seen that number forecasted before. I think, as we've talked about with these exchanges, it's all about ease of use and how can companies utilize an exchange that is easy for the end user to understand, to utilize, and I think engagement's big. That's the big buzzword we're hearing, engagement across all these platforms.
It starts with education, and it starts with helping them to understand where these benefits are, what they cover, how to utilize them in their best manner, and then find the plan that's going to work best for each person. I agree. One of the things, and we've talked about it on the program to everybody, we actually in November of last year launched privatehealthcareexchanges.com, and what we kind of looked at in the market, again, was that all these exchanges were coming out, and there was all these different models from single carrier to multi-carrier to having a retiree health option.
And so for privatehealthcareexchanges.com, what you can do, it is on a subscription model, $99 for a month, or you can buy a subscription for a full year. The benefit of buying it for a full year is that this database that we've built is going to expand as more exchanges come into the market and as more companies look to want to be included in the exchanges. We're actually in the process of working on a third phase of this of privatehealthcareexchange.com to really focus on the solution providers who want to be offered inside of these exchanges. And so if you are interested in the information within privatehealthcareexchanges.com, it is the only database in the industry right now that actually houses, this type of information. I believe we have over 160 exchanges in there, and it provides their model. It provides contact information, whether it's to a sales rep or whether it's to a product development manager, that you can actually connect with them. So that's one of the items that we've been working hard on here at the Institute. And so if you're interested, go to the website and check that out. But moving, Cambria was actually an exhibitor with us at IHC Forum here in Atlanta, and we're now moving towards IHC Forum West. That's going to be in Las Vegas, November 10th through 12th. And really the focus of that event, as you've heard us talk, is let's look at what happens in open enrollment. You've got a lot of different elements taking place this year before the event. You've got the election, which I think is a week or two ahead of the event, so we're going to get a real-time look in at what happens, in Washington, which is, as we all know, we deal with Washington within our business quite often. So we have to figure out, what's going on there. But the benefit now is what's happening with open enrollment. If you look at these exchanges, did people enroll in exchanges? Was that a direction they moved? Did people look at high-deductible health plans and full replacement programs to move to? So what was the engagement in programs out there? What kind of education did the employee population, how'd you educate them on the benefit plans, and what did they choose? So that's going to be a big play there at IHC Forum West. And then also what we've done is we've actually got a really good group of employers that are really going to provide case studies on what they've done around making healthcare consumerism work. As we hear, across the marketplace all the time, it's the consumerization of healthcare. And, how can employers, brokers, consultants, health plans, third-party administrators, how can they put plans in place, for their users to really empower them to become better consumers of health and healthcare. So for everybody out there, IHC Forum West, there's now $99 deals out there. So if you want to sign up, you can get it for $99. There are some pre-conferences there on exchanges, on making healthcare consumerism work. So we do invite you to join us there. The last thing before we go to break is the certification program, and it's something that we rolled out with IHC Forum and Expo, IHC certification. And I had a question come to me the other day, is what can I expect to learn regarding certification? And the quick answer to that is that you can learn the A to Z's of healthcare consumerism. And as we've always defined, healthcare consumerism isn't about just an HSA with a high deductible. That's a piece of healthcare consumerism. But the deeper pieces of healthcare consumerism are the retiree health benefit piece, are the front-end exchange piece, are the HSA piece, and other pieces, engagement. So you can expect to learn, the A to Z of healthcare consumerism. And thanks, everybody. Stay tuned for the next segment of HealthCare Consumerism Radio. Hey, everybody. Welcome back to HealthCare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for Healthcare Consumerism, and joined in studio with Cambria Smith, President of Transitions RBG. And Cambria, let's dig into your business a little bit. I think, the retiree health exchanges have a big play here. You saw a lot of movement a couple years ago on some of the big consulting houses going out and buying retiree health platforms and bringing them underneath their umbrella. Kind of give our audience, a feel for your company and your position in the market.
Absolutely. And we work with employers looking for solutions for their retirees as well. And so what our organization does is we sit down and try and figure out the plan that's going to suit the culture at your organization the best. And sometimes that's going to make sense to go to an exchange depending on what you're trying to accomplish. We've had a couple clients lately decide that they wanted to go alternative routes, and it's a win-win situation, and that's what we look to sustain with our employers.
So you're not necessarily an exchange. What's the difference between your model versus maybe what one, maybe an Extend Health or some of the other players out there might have?
We have multiple tools in our toolbox. And so we're able to sit down, talk to the HR director, talk to the CEO, and figure out what they're trying to accomplish in this reduction. You know, we have employers come to us and say, we have so many aging employees on our current plan right now. What can we do? How do we transition them off? And I think that's what most employers want to say. We have this entire aging workforce. How do we get them off of our active plans? And you can incentivize. You can't do those types of things. But what we do is we work with the employers so that they can have a soft landing for their employees into Medicare and help them to achieve a retirement plan that people aren't scared to go to, because most people don't want to work their entire lives. A lot of people would like to find a retirement spot so that they can finally sleep in those mornings or have a life outside of work.
One of the things, and I can't remember what I was watching, but it asked, I think I was at a conference in a workshop, and the question was, how much money would you have to save up for health care and retirement? And it was $250,000.
It's a lot of money.
It was a lot of money. And, I think, going back to and seeking to understand with the employers out there, are they slowly moving these people off of their benefit roles towards your option, or is it one big offload? What's kind of the scenario there with an employer? Does that make sense?
It does make sense. It's a little bit of both. And so it depends on how they're retirees. So if I'm an employer and I have a couple different ways that my retirees could be accessing my plan, okay, we could have them on what we call an access plan so that our retirees are still tied to our self-insured health plan. And so in that case, our retirees stay on our plan, and then for what we have accounted or allotted as their monthly premium, they write that check to us.
Okay.
And so some employers do that with their retirees. Other employers have them, in slang term, a carve-out. So they've been removed from that active pool of employees over to a different type of a plan, to where that plan is self-sustaining with just the retirees.
Okay.
And so there's different models. So in an access plan, what our company would typically do is to go in there and try and figure out what's the best win-win. Do we begin shifting these access retirees rather, over to an exchange, or do we begin shifting these retirees to a carve-out style plan to where that could be fully insured to offset some of those costs for that employer?
Now, when you say employers, is there a certain size employer that you all work best with, or can you serve all different size employers?
We serve all different size employers. We really do very well in helping employers that are in that middle market segment, mm-hmm, and there's not a lot of support in the retiree space for those employers today.
And just, this is an assumption, correct me if I'm wrong, you have to have obviously an employer size that has a retiree population that's coming into play. So mainly mid-market, but you can serve the bigger guys as well.
Absolutely. We do all the way.
So you had mentioned the access plan, and I think I was on your website. I think it was a soft landing plan. Mm-hmm. So there's multiple different options that, based on the employer and what their needs are, where you can put them on your side of the house and put them into your plans. Is there any other plans that you have?
Well, we have two main plans that we roll out outside of our retiree solutions. We have what's called our Caregiver Assistance Program, and our Caregiver Assistance Program was created based out of a need. With more and more of our family members that we love and care for aging, we find ourselves, the sandwich generation, overseeing their needs. And so what we did was we rolled this caregiver assistance program out to all of our employer groups. So they're active employees who are literally between the ages of probably 30 to 55 years old who care for mom and dad now have a resource to reach out to for not only their Medicare questions, but and when I say resource and referral, I'm literally talking you can call for advocacy for mom and dad if you need help with an assisted living location service, if you need help with a senior moving company. And so we did this, and this has been able to help employers work on absenteeism with their employees. And so they can make one single phone call over to our organization and their care team advisor at Transitions, and that person can give them the support that they need in less than 30 minutes on a phone call followed up with an email, and somebody else can go and do the hard work for them so their employee is able to focus on their job at hand and not have to take off excessive amounts of time.
So you're actually confronting two different pieces of the puzzle. And I think if you look at the baby boomers out there, the retiree world is going to continue to explode, with all these people.
That's right.
Retiring. So when you're talking to these employers, and one of the things when you walk into them and you're talking, about the retiree health population, what's the first thing out of their mouth?
If we're being candid, we have all of these people that are over age 65. Is there anything that we can do? And the answer is no. You can't incentivize them to leave. You can't pay their premium. You can't offer to put them on Medicare. They're your active employee. And so what you can do is you can educate your employees to understand what alternative options are outside of their group benefits. For example, Sid comes down to the HR person's office, knocks on the door, and says, hey, I'm turning 65 in 2 months. What do I need to do? Well, that HR person really should not find themselves in a situation to ever advise or direct somebody in a direction. And so what we want to do is give them a solid third party that they can say, give them a call. Let them help you through what you need to enroll in, what you don't need to enroll in regards to your Part A and your Part B. So if you're an employer group and you're under the size of 20, Medicare is going to be primary. If you're an employer group and you're over the size of 20 employees, then your employer plan is going to be primary. And so what we have to dive into is to find out, does your employer plan require A, B, or a drug plan to be added onto it? And so it's very situation specific. It's very plan specific. And so that's where we work with the employers to make sure. Because when we first started making calls to employers, they were not aware that all of their employees who were over 65 on a non-credible drug plan were getting a Part D penalty for the rest of their life once they did retire and leave their employer plan if they retired at age 70 versus turning that plan on back at age 65.
So there's some things that are going to benefit the employer, but also the plan participant, the employee themselves on the knowledge.
That's right.
Once you hit that age 65 and what you can't or where the penalties are for you and for your employer.
Exactly. And that's really the soft landings program. So the three programs that we offer at our offices are the caregiver assistance program, the soft landings program, which was designed to help employers who do not have a retiree plan, do not want to establish a retiree plan, but need somewhere to educate and support their aging work population and the employees who are making that transition from active employee to retired employee.
Now, and forgive me if this is a stupid question. There's a lot of people out there that even though they've been paying in, for Medicare or whatever their retiree health benefits, maybe they don't want that, right? Some of them don't choose to want that.
Right.
And is that the question they're going to their employer saying, hey, can we look at Transitions RBG versus me having to go
and figure this out on my own?
Yeah, figure this out on my own and maybe get into a government program.
Right. And so what we want to do is we just want to help that educational, and everything that we do starts at education. And so as you're talking about educated consumerism, That is completely our model, as well as we want to make sure that every single one of our clients understands not only the ins and outs of their employer plan that they're currently on, but can also understand what their options are going to be once they go into a Medicare plan of some sort.
So you are most of your discussions with employers, and in the next couple segments, what I want to kind of get to is there a broker role there, or are there some case studies? But are most your conversations with the employers directly and their benefits teams?
Absolutely. So we start there, and then they all breathe that sigh of relief that they now have somebody that they can hand this responsibility over to, because they're not comfortable having these conversations, and they really shouldn't be. And so then we go on to being the educational resource for their active employees as they go from active to retired. Mm-hmm.
So if you could look at kind of the space right now, is there, with the employer, is there a number, and maybe we can get into this going into the next segment too, is there a number that, that they save? What's the financial benefit for them to bring on your program?
It depends. It depends on what aspect we bring them on.
Okay.
And we can delve further into that when we get into the case studies, and you'll be able to see those numbers.
And so there's very interesting. I think employers out there right now, and Doug and I, talk about this all the time, and Ron Bachman, chairman of the advisory board here at the Institute, is employers out there are looking at all different options. And I think the retiree health option is obviously, with the baby boomers, that's, something that's going to just continue to grow and grow and grow. And I think your solution, is well timed, in a market that's just exploding. And then as these, my parents start to retire and move on into what their golden years should be, are there some options? I've actually had them come to me and say, hey, Brent, what are some options out there that I can look at from a retiree health standpoint? I think I talked to you about it at our conference. I've got an uncle in Canada who was coming down and saying, hey, how do I, what are some options that I can look at in the States, because that's where I'm going to retire.
Right.
And so it's interesting, very interesting. Well, everybody stay tuned for the next segment of HealthCare Consumerism Radio. Hey, everybody. Welcome back to HealthCare Consumerism Radio. This is Brent Macy, Managing Director for the Institute for HealthCare Consumerism, and joined with the President of Transitions RBG, Cambria Smith. And, in the last segment, Cambria and I really talked about, what her solutions are for employers specifically. In this segment, for all you brokers who are out there listening, or advisors or consultants for that matter, what the role is for you with her retiree health solution. And, Cambria, give us a quick idea of the role you play, with brokers and what the options are for them.
Absolutely. One of the things, I had a consultant this week tell me that she went and sat down with one of her clients, and she told her, list out the top 10 most important items that she need to tackle in the next 12 months. And the number one item on her list were her retirees and retiree benefits. And I think that as consultants, and we have great relationships not only in the Southeast with consultants, but all over the country, I think that the commonality there is it's not an area that's their expertise, and so they have a tendency to shy away from it and go to where they're comfortable and making advisements in areas that they are more comfortable, which makes sense. And so I find that consultants are looking for somebody who they can trust, who's going to partner with them and give them the resolve, the support, and the recommendations that they need to be able to take to their clients.
So what you're saying, the major medical is more their bread and butter. Major medical, voluntary,
Absolutely.
The front side of the benefit plan. But as we talked about in the segment before, with the aging population, there's more that need to understand from a broker consultant standpoint, the retiree health side. I think, on the program we've talked about this all the time, is that brokers consultants are looking for ways to continue to supplement their income, from a not necessarily a commission standpoint, because they're not necessarily commission driven. They're trying to help their clients, but they want to look for some solutions out there that help them better serve their clients. And I think you're right with this one that it's just an education process.
It is.
How do you make them aware of what the solutions are? Because there's a lot of solutions coming at brokers right now. You got so much out there that everybody's saying, hey, carry my product.
That's right.
It's how do we educate them? If you're talking to a broker and you had mentioned one, she put at the top of the list, the retiree health side of things. What is it that they ask you specifically about retiree health benefits?
Typically it's cost cutting. I mean, they're looking to make some sort of a transition to reduce those costs. And the way that you address a pre-65 population versus the way that you address a post-65 population are night and day. Now, your pre-65 population, you make changes to their plans and you do something and they grumble a little bit, but they're still working full time. How much time do they have to invest in their grumblings? Well, not much, because they have children they're raising and families and active lifestyles. Okay, well, you go to a post-65 population who's all retired, you start making changes to their benefit plans that are very negative. All they have to do is to grumble and complain. And so that's why we work towards that win-win situation, is because those are the people who are calling the news stations, calling the newspapers, showing up at the employers. They are not a happy group of people. And so what we work to do is to help our consultants and the people who we are partnered with to help find that win-win situation. And how do you do that? So like you said, we start with an educational platform. We go through all of the steps to educate our retirees so they understand why the changes are coming, how this is now a sustainable benefit.
Now, are these tools for the broker to take?
Yes.
Okay, these are tools for the broker to take over there. Okay.
That's exactly right. And so we're going to work with this broker to be able to educate the employer, to show them how we can make different changes to their plans to create this win-win situation.
Now, is the broker doing some necessary hand-holding, with the employer and that population? A lot of times you see voluntary benefits. Sometimes there's a broker on site there during open enrollment. Is that the case with retiree health benefits?
Typically, our advisors are doing the interface between the retirees at that point.
Okay.
And so the broker, what their role is to understand the options, become educated on what resources are really available to employers. There's a lot more than one checkbox to a retiree benefit plan. And so we want to make sure that they understand that and help to make this transition a very smooth transition, depending on whatever type of plan. And these brokers will walk into situations to where there's the access plan, like we talked about, where an employer has something set up where everybody's still paying right into that self-funded plan. Well, brokers, consultants, that has to stop. That plan has to stop the way that it's set up. It needs to be changed. And so when you see that type of a situation, you need to contact somebody who's a subject matter expert in a post-65 market so that you can recognize and help your client to recognize one of the places where they're going to be paying higher fees and they're going to be affected through the Affordable Care Act changes.
So the brokers, they're able to look at this and go to their employer client and say, hey, here's where some waste is maybe?
Absolutely. They've got some costs that they could reduce.
From a cost standpoint. And I think if you look at the brokers out there right now, if they can better serve their clients and help them save some costs in certain areas, that's very beneficial to a lot of things, because employers, let's face it, their healthcare costs are going through the roof, and any dollar saved is good. So what is the model for brokers and consultants? Kind of how do they, if they pick up your solution, are they compensated, by taking their solution to employers? Is that the benefit for a broker?
There's a compensation stream there that's available through our partnership channels. And so one of the things that we work with our consultants on, and one thing that people may not know about transitions, is we don't operate a call center. It is not a call center style model. That is not how we do business. I can't stand picking up the phone and calling call centers and getting patched around to 32 people and looking for somebody.
Or a robot.
Yes. Yeah, that really frustrates me when I'm hitting zero. And just a clue that if you yell turquoise into the phone, the systems can't recognize the word turquoise, so they'll patch you through most times to a rep.
Right.
Just a little tidbit. But none of us like that. And imagine finding yourself in your 80s and you don't hear well and you're trying to get somebody to help you with a question or a concern you have, and you're constantly being patched through, or you're telling your story 4 times, your frustration levels are going to go through the roof. And so when Transitions designed how we work with our brokers and our employers and our retirees, we have assigned reps for every single one of our retirees. So they get a direct dial phone number. They talk to the same person, full-time employee, all year round. And so they're able to build that relationship and build that trust. And so we do the exact same thing with our brokers and our consultants so that they have the opportunity, to build that exact same relationship with an advisor inside of Transitions.
Now with and when you mentioned kind of the age group, that's a different, you got to communicate with that group much differently than you would communicate with the millennials or even a little bit older group. I mean, they take their information in a different way, and they don't like, they'd rather write you a letter sometimes versus getting on the phone. So, from a broker standpoint, if I'm a broker trying to take your product into an employer, how am I going to communicate? What's the best way for me to communicate with these retirees that you guys have?
And so you're going to utilize our services for that direct communication to the retirees. We have so many different programs in place internally to help do that.
The one you mentioned was the individual. I've got a number to one specific person.
That's right. That's one. And that's been a huge selling point for our company because I know me personally, I feel that way. And so if I can pick up the phone and call and get the same person when I need help. And I've utilized our own services for my own grandparents in the past year and a half. My grandfather was getting transferred from a hospital location to a skilled nursing facility, which is one of our caregiver programs that we give. I needed to have a phone number for a skilled nursing facility in Tallahassee, Florida, like within 30 minutes. And so I contacted our service, and I was able to get that phone number handed to me. Within 30 minutes, I had a bed reserved for him at the location we wanted. That took his insurance. And so it's a phenomenal program and service that we are able to offer to our retirees. And I was working that day. And so it took me all of 5 minutes to make a phone call, and I had everything I needed back, and I wasn't on the phone calling skilled nursing facility after skilled nursing facility to get what I needed.
Now, if you look at the brokers out there, I think they're all trying to adapt and find the best solutions out there, and because the market's changed so fast, they're looking at all these different options, and they're saying, okay, what's the best of breed? Who do I go to? Do you guys work with any specific brokers on a regional structure that they can become exclusive, or is it, if you're a broker who's just looking to best serve your client with a retiree health benefit, they can come to you?
That's right. They can come to us.
Okay.
And so we work with brokers nationally. We help them with their clients. Our company is only in the post-65 market. We don't work in the pre-65 market at all. And so there's no conflict there when it comes to employer groups or any crossovers. There's no gray area. We work in a post-65 method.
Why was the decision you just wanted to be the best at the post-65?
That's exactly it. I mean, we are here to work on the needs of a post-65 generation. And so we work with the employers, we work with the consultants to find the best solutions for their aging employer.
And so you don't, and I think that's smart. I think you got there's a lot of moving pieces with the post-65, especially with the number of people about to come into the system.
10,000 people a day.
Wow. Yeah, that's a lot. I think that's a very good position. If there's a broker out there, what's the one thing that you could kind of tell a broker, about the retiree health benefit? Why do they need to recommend it?
If they're not knocking on their door and talking to their own clients about it, they're either calling us or they're calling somebody else without their knowledge. And so make sure consultants that you are helping your clients in all their aspects. If you have to write a list down and say number this 1 to 10 on what's most important for you, you will find retiree benefits on there. And so you'll need to have a resource, if not today, at some point in the future, because that question will come up. They do have aging populations. We see more and more of it every single day. We, over the course of the last couple of years, the employers that we started working with several years ago, all of their retirees are coming to age now. And so if they're not having that conversation, you're going to.
If they're not having that, somebody else is
That's right.
talking to your client about that possibly.
That's right. And you're leaving the door open.
Wow. Very interesting. So the model, for the brokers, from this is that there is a role to play in your solution, and I think that's a lot of models out there. Especially if you were bought by a big consulting house or the big consulting houses that bought this piece, they're only available to the consultants that work for that company, and so you have a unique position in the market. That hey, if you're a broker out there listening to this program, the Transitions RBG program is available for you to put in your bag, as opposed to some of the other ones out there. So I think, the brokers, they're looking really hard at this, and it's very interesting to see where the market moves. Well, on the next segment, everybody, we're actually going to get into a case study that Cambria has here on one of the clients that she did work with, so we can actually put some practical use on this solution. So stay tuned for the next segment of HealthCare Consumerism Radio. Welcome back to HealthCare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for HealthCare Consumerism, joined in studio with Cambria Smith, President of Transitions RBG, and we've been talking about retiree health solutions for this whole program, and really want to get into a case study that Cambria did with a company in the country here that was looking at their solution, had some problems that they needed to solve, and Cambria and her team came in and helped them solve those problems. But we were kind of talking in the break, and I was just kind of asking Cambria for a little bit of clarification on when, if you're an employer, should you look to put this in, since it is a post-65 retiree health benefit exchange. So, Cambria, if I've got an employee population and the oldest member of my team is 55 years old, do I need to look to your option at that point, or maybe a little bit later?
I would say the sooner the better.
Okay.
Because you're going to find that we talked about that sandwich generation. It gives them a resource that's going to help with that employee absenteeism, but it's also going to give them access to all of our educational tools. Okay. And so at Transitions, our focus is education. Period, end of story, and I've said that 100 times, I think, today alone. But we talk to CEOs, we talk to CFOs, we talk to attorneys, we talk to doctors. Nobody understands Medicare. And so people have questions and they need help, or they want to understand how different things work. It starts with our educational foundation. And so we want to invite these people and give them the opportunity to attend our seminars around the country. We want to give them opportunities to have on their employer portal one of our Medicare educational self-paced seminars so that they can go through that webinar at their own pace. We have resources for employers that are, when do I enroll in Part A, when do I enroll in Part B, which are just little video snippets that are less than 7 minutes long that they can have on those intranets to help those employees understand where I need to based on my plans.
Interesting.
So it starts with that educational. So you may not have employees that are over 70. You may not have employees that are over 60. But you never know when somebody needs a Medicare resource. For example, your 55-year-old employee could qualify for disability. And so if they go on disability prior to age 65 and they go through that waiting period and Medicare goes effective, they may be under 65 and still need to have that Medicare resource so that they understand how to utilize the program.
Okay. I got it. So the sooner the better for a lot of different reasons from a purely educational standpoint. I know you've got a couple case studies that you've done. Kind of tell our audience a little bit about this company and what they were looking for and how you guys helped them.
Absolutely. Recently, we had a company, had 2,000 retirees on their plan, and then they had another, I would say, 350 legacy retirees, meaning that when they sat down and looked at what they could do with their plan, they could take the 2,000 retirees and move them off of the plan with no consequences. And then they had this reserve group, we'll call them their legacy retirees, that they could not cut off of the plan, that they were forced based on all of the promises made that they had to keep them on an employer plan. And so what we did with this group was we set all of our wheels in motion, and this particular employer was in a position where they could not afford to fund any type of an HRA. They could not fund a single penny towards these retiree benefits. So these retirees lost their coverage 100% with zero funding, and Transitions did their offboarding. Through that offboarding with zero funding in our educational process, 87% of their retirees enrolled with Transitions.
Wow.
Which is huge. And it's because of our system where we work with the advocates, we work as advocates, where we have our educational platform, and because they're able to build that relationship with their advisors, we were able to protect that many of the retirees. So 87% of their retirees enrolled directly through Transitions, and we continue to support them today.
Now, one of the things, so did this population it was the 200, the legacy ones, and so they had to stay on that employer's plan by law?
They did. By law, they had to. So what we ended up doing, was they were on an access plan attached to their self-insured program.
Okay.
So we went into them and we carved them out and shifted them over to a fully insured plan. And we took all of the Affordable Care Act implications and fees and shifted that over to the fully insured plan.
Okay.
And so we were able to reduce that. We increased their benefits and reduced their premiums all in the same stroke.
And so these 2,000 retirees in this case study, they were at risk of losing their benefits that were promised to them by the company from a funding standpoint.
That's exactly right.
So there's a lot, you read about it all the time in the news. There's a lot of people from a retiree health benefit standpoint that the company just throws their hands up at some point and says,
we're done.
You're not getting it anymore.
That's right.
Well, we promised it to you when you started working for me when you were 32 years old. You're done. So that's significant.
We went in and we protected that group and worked with the employer to do it. And the employer trusted us with our education techniques and the way that we work with our advisors and how our advisors interact with our clients, our retirees. And we were able to sit 87% of these retirees into our Medicare exchange, because we do own and run our own Medicare exchange. But we utilized the exchange for them, and they were all able to find plans that met each of their needs the best.
And so if you're an employer out there, don't throw your hands up and say,
that's right.
Don't rock the boat right away because
That's
you
right.
think you're out of options. That your solution has come in to fill that void to those employers who say, gosh, I can't do this anymore. Sorry, guys.
You're done.
You're done, yeah, which is completely...
Don't throw the baby out with the bathwater.
And you're going to rock the boat and you're going to have a lot of mad people.
That's it.
When I look at these 200 legacy, is that maybe some union people or
this was not union. This was a non-unionized company. We have worked with union employees in the past, and we do have other case studies where we work with them and extend those trusts as well, and give those employers resources beyond what they think they have.
Because I think one of the big discussions out there right now is a lot of these unions are not necessarily happy with the healthcare law, and one of those is that most unions get to enjoy the benefit of a Cadillac plan, and with the Cadillac tax that's coming into play, here in a few years, which is kind of crazy to me that you're going to tax somebody for providing best benefits, but that's what's going to happen. If you provide a Cadillac plan, you're going to get taxed a percentage on that. If I'm a union, I can look right at you guys and say, from a retiree health standpoint, I can move your direction too, right?
That's exactly right. And so we have so many different, and I use tools in our toolkit, different ways to help these employers, these associations, and these unions to find the solution that meets what they're trying to have as their outcome. So without being too vague, we were able to, in just a simple case study, we took 2,000 of them and we moved them to an exchange. However, what about those other couple hundred that we couldn't move to the exchange? What happened with them? So that's where we made other alternative plans to protect them and keep the employer's legal responsibilities completely intact.
Now, as we look to wrap up the show, I kind of want to get your opinion on one, the ACA, so the healthcare law that's out there, and what's the effect for your business, if any?
One of the immediate impacts that we see, and kind of perfect timing on this, is we're seeing the Medicare, if we're talking about the Medicare exchange, we're looking at the Medicare Advantage plans, and that's probably the market that's the most volatile. So if you have your retirees on a Medicare Advantage plan, it's probably worth just looking over that to make sure that that's still the best solution for your retirees, because we're seeing a lot of changes, so to speak. You've got United Healthcare dropping providers in the Northeast. You had a Medicare Advantage plan literally just go out of business. The state of Florida shut them down. The state of Florida shut them down 2-3 days ago. Wow. Had 50,000 members taken off their plan, HMO out of Florida. And so they lost coverage and will be looking for new coverage on 7/1. So I think the biggest disruption that we're seeing from the Affordable Care Act would be the Medicare Advantage world. The other thing that we're seeing is employers just need to be made aware that if you are allowing your retirees on your self-insured plan, there are fees that you're paying under your self-insured plan due to the Affordable Care Act that you weren't paying before. And so it's probably advantageous for you to look at the different alternatives in that realm as well. As far as post-65 benefits really being affected by the Affordable Care Act, the original Medicare network is what we tell people to look at first and foremost. And that if you're going to go onto original Medicare or Medicare supplement, you have to ask your doctor if they're in the original Medicare network. If you're going to go towards a Medicare Advantage style plan, then you have to ask your doctor, are you in the original Medicare network? Do you accept XYZ Medicare Advantage plan? And are you accepting patients? And so it's a little bit more hurdles, so to speak, for our clients, but we want to make sure that they understand that those changes are coming.
Well, Cambria, I really appreciate you joining me in studio, today. Very informative, for the employers, brokers, consultants, health plans out there, even the TPAs. Let them know where they can find you and contact you.
Absolutely. If you guys want to learn more about our organization, you can go to our website at Transitions with an S, RBG for Retiree Benefit Group. So transitionsrbg.com will take you to our website. And if you want to call and speak with somebody at our office, our 800 number is 800-936-1405.
Well, Cambria, thank you so much. Enjoy the Country Music Festival down in Jacksonville this weekend. And to the rest of our audience, we will talk to you next week on HealthCare Consumerism Radio.